integrative management of cancer. This comprehensive guideline, containing more than 10 million Chinese characters, has been translated into 16 languages and includes the 46,500 continuing the medical education, CME, questions and answers. It covers 113 topics, including 53 types of tumor and 60 techniques, covering the 97% of Chinese tumor patients. By adapting previous guidelines and emphasizing the uniqueness of Chinese physicians, it becomes a standardized guideline system with both Chinese characteristics and the international perspectives. In November in 2024, during the opening ceremony of the 2024 Chinese Congress on Holistic Integrative Oncology, the 2025 edition of CACA guidelines for tumor chapter was released. This year, the technical chapter will be updated. While international guidelines primarily concentrate on diagnosis and treatment, CACA guidelines for holistic integrative management of cancer focuses on prevention, screening, diagnosis, treatment, and rehabilitation, uniquely incorporating the wisdom of traditional Chinese medicine. It is widely recognized that about 1/3 of cancers could be prevented through lifestyle modification. By focusing screening efforts on high-risk population, we can achieve significantly better outcomes with optimized resource allocation. Equally crucial is our emphasis on post-treatment rehabilitation, which plays a vital role in ensuring long-term well-being for cancer survivors. These integrated approaches represent a transformative shift in cancer care philosophy. The CACA technique guidelines for holistic integrative management of cancer establish a comprehensive framework that balances both advanced medical techniques with personalized treatment strategies. These guidelines prioritize the multi-dimensional approach encompassing assessment, support, control, protection, and survival. Our HIM model consists of 5 fundamental pillars. The first is a comprehensive assessment conducted through patient evaluation before surgical intervention or treatment. The second, the multidimensional support, address nutritional and psychological needs to optimize patient readiness for procedures. The third, precise tumor control, focus on regulating cancer cell proliferation rather than indiscriminate eradication. Fourth, the organ function preservations that prioritize protection of highly tissues and the maintenance of physiological function in the different organs, the normal organs. The last, survival outcomes, establish long-term survival and the quality of life improvement as primary treating goals. This slide compares the CACA guidelines with international guidelines such as the NCCN and the ISMO. The CACA guidelines demonstrate unique value through 3 key differentiators, incorporating robust Chinese clinical evidence, detailed descriptions of surgical passes and procedures with integrated diagnosis, emphasizes on rehabilitation with TCM. These elements collectively create a guideline system that is both globally informed and distinctly adapted to China's clinical and patient needs. To advance the implementation of a CACA guideline nationwide, we have undertaken extensive promotion efforts over the past 2 years. CACA has conducted over 100 educational sessions targeting both medical professionals and the general public. These initiatives have achieved a remarkable reach, accumulating more than 2.6 billion online views and demonstrating our strong commitment to raising cancer awareness and improving treatment standards across China. On top of the aforementioned, we have also held over 2,000 specialized training sessions for physicians across all regions of China. This comprehensive educational program has successfully equipped doctors throughout the country with the latest evidence-based practices in cancer prevention and treatment. Through strategic collaboration with 226 Chinese universities, we have established a framework for oncology education that simultaneously advances cutting-edge knowledge transfer and addresses real-world clinical needs. This partnership serves as a platform for cultivating the next generation of highly skilled oncology professionals, ensure our educational program remain at the forefront of cancer care innovation while directly responding to evolving healthcare demands. Holistic Integrative Oncology, HIO, an English journal covering all aspects of oncology research, was launched in 2022. It is the open access, peer-reviewed journals. Our editorial board comprises over 100 leading experts worldwide, and we welcome more well-known experts to join us. To date, 159 papers have been published in HIO, which have been accessed over 200,000 times. Last November, we held the 2024 Chinese Congress on Holistic Integrative Oncology in conjunction with the 4th International Congress of Asian Oncology Society in Xi'an, China. Professor Alexander has joined this great event. It is a significant platform to promote the concept of the holistic integrative management of cancer as well as the CACA guidelines. This November, CACA will organize 2025 CCHIO in conjunction with the first annual meeting of the World Association for Integrative Oncology Society in Kunming, Yunnan Province, China. CACA has laid the foundation for developing holistic oncology in China through a series of strategic steps. However, we know that this is just the beginning. On November 16, 2023, we have taken bold steps by launching WAIO in China, calling on scientists, oncologists, medical students, and the public to face the cancer challenge in the spirit of solidarity by integrating theories in various fields and disciplines as well as clinical experiences. On November 16, 2024, the General Assembly of WAIO was held in Xi'an, China. During the General Assembly, the WAIO Constitution was approved and adopted. A new leadership team was elected. I was elected as the WAIO president. While we have been learning and benefiting from the foreign guidelines, the entity to him model in CACA guidelines could also reversely benefit other countries. The 5-year survival rate in Western countries is 70%, and China's rate reached 43% through the adoption of foreign guidelines previously. The CACA guidelines will help us improve the remaining 60% and may provide the references for foreign countries to solve their remaining 30%. That is my talk. Thank you for your attention. Thank you very much.
Thank you, Professor Fine, for your inspiring presentation. The presentation showcased the CACA guidelines, provide us with a comprehensive understanding of how these guidelines cover the full spectrum of cancer management. It serves as a valuable reference to clinicians, offering clear guidance for their clinical work. Additionally, the CACA guidelines present a Chinese approach to global cancer control, playing a significant role in advancing and promoting international efforts in this field. We appreciate the knowledge and vision you shared today. Thank you again, Professor Fine. Our next speaker is Professor Alexander Mildinger. Professor Mildinger is a specialist in internal medicine and radiology. He was a director of the Radiologic Center of Niels Tensen Clinics since 1995 and directed the breast imaging and intervention section at Franciscus Hospital. He served as a president of the International Breast Ultrasound School in 2005 to 2011 and Cynological International Society in 2015 to 2016 and is currently vice president of CIS. As the founding member of the DEGUM Level 3 Breast Ultrasound Group, he is the national consensus expert in multimodal breast cancer imaging. Since 2020, he has focused exclusively on cynology. He is an honorary member of several medical societies due to his scientific merits, including the board director of World Association for Integrative Oncology. Today, we are privileged to have Professor Alexander Mildinger share his insights on the topic of immense significance, artificial intelligence in breast cancer diagnosis. Please welcome Professor Mildinger.
Dear Ying, thank you very much for this very kind introduction. But first, I would also like to congratulate Professor Fan to his excellent talk. And I'm personally so impressed what CACA does for China and its fantastic performance I experienced several times. But now it's on artificial intelligence in breast cancer diagnosis. And I would like to appreciate that China is one of the leading countries of artificial intelligence. And my outline is very clear. I start with a short intro and will end with take-home messages. And the introduction focuses not on the whole spectrum of AI, but only on convolutional neural networks that handle images, that handle digital images. And the architecture of these convolutional neural networks are programmed to perceive each input as a digital image, Each image is divided further to patches that can be multiplied for extracting particular features, and every layer comprises image filters that detect characteristic features. Here we have such a training data set, an input layer, an output layer, and these are the filters applied to images like blurring filter, edge detection, or smoothing filters, and so on. Just a short introduction, and this is the first mammography showing us an architectural distortion, which is easily to see in this plane, and AI will detect such a subtle on the second plane architectural distortion and will offer the reader heat maps after AI classification of the images, and these heat maps stand for the probability of cancer. Red means high probability in this case. Now let me focus on AI in breast cancer screening. And first I start with the German screening program and I ask you, can AI improve it? Yes, we are quite good already, but I'm sure it will improve it. And here are our prevalence data and follow-up data concerning the detection rates. And interestingly, the new Toshima study also showed the value of detecting 1.2 additional cancers per 1,000 participants by tomosynthesis. If we compare the previous opportunistic screening before 2005 with the current screening program, we have follow-up data, and it's very clear to state that we have an increase in those cancers with a very good prognosis, and we have a decrease of those with a poor prognosis from 44 to 21% currently. This image should show you how AI also can be used to improve the image quality. Here we have a tomosynthesis slice, courtesy of Hologic, and we see that in this AI-powered tomo slice, we have a better delineation and a better contrast compared to the previous ones. So what can convolutional neural networks provide in digital mammography and tomosynthesis? First, the differentiation between benign and malignant tissues. Second, the localization of suspect lesions in the breast tissue. Third, the classification of breast density. And fourth, the risk of breast cancer for the current image study and the future prediction, which is very interesting. And the use of bilateral and prior images is possible by new technologies like transfer learning for asymmetries and growth that will be added to the classical CNN technology. Now I would like to focus on the concepts and concept of AI as a standalone system or AI as a decision support system after reading by a human person. This is the scheme of a classical screening program, double reading by humans, and every pathological finding comes to the consensus conference. If the second human reader is substituted just by AI CAT, which stands for computer-aided or computer-assisted detection,